Not surprisingly, we've seen a sharp political backlash that has made these goals of better health care seem much more distant. Every day now we hear a drumbeat of troubles. We can't afford this or that entitlement. It's busting our budgets, we need to find a better way, and all of us are squarely in the hot seat as this debate unfolds. But through all of this, you, the members of NAPH, have stood by your patients. As 9 million Americans lost jobs, you were there to pick up the slack. As states pulled back, you have found ways to do more, often with less, often much less. You've made a promise to your communities, and you have kept it. Now there is talk of significant, maybe huge federal reductions in programs like Medicaid. At a time when we're supposed to be building towards the coverage expansions of 2014, we're instead thinking about dismantling the very foundations of reform. It is hard to imagine how we will build toward access for everyone if over the next few years we take health care away from millions of Americans and injure the safety net which they will need to make access a reality, not just a theory. These trends are not going to be reversed anytime soon. Pressure on Medicaid and the safety net may be even sharper in the years ahead, sharper than expected. A protracted economic recovery will not make things easier as tax revenues lag. Erosion of employer-based insurance could continue, and I'm not sure that always the low individual and employer penalties of the Affordable Care Act will reverse that trend. Estimates, frankly, that a future America will have only 22 million uninsured Americans might be optimistic. So we may be turning even more to Medicaid in the years ahead. Like it or not, Medicaid is now how we cover the single largest group of Americans. We can decide to continue to do so, or we can pull back, cut, knowing the result will be fewer people with insurance, more disease, more death, and an even bigger cost shift to providers and individuals. In the weeks ahead, as deficit talks heat up, we'll hear a lot of talk about caps or triggers or other so-called reforms. But be clear that these really are reductions in care for the poor. They are cuts to Medicaid, and these are things that will take needed health care away from real people. But in all this uncertainty around national reform, there is some very good news. The pundits and soothsayers can read the entrails and try to predict what the Gang of Six will do, or the Biden group, or the Tea Party caucus, and all of that's important. But I also know today that there are places where real reform is not going to stop. There are places where innovation is the rule, not the exception, where there are leaders and professionals every day building a better healthcare system for everyone. And that is among the members of the National Association of Public Hospitals and Health Systems. I can't even begin to list all the examples, but let me talk about a few. We know that when it comes to better serving a community, Wishard Health Services in Indianapolis, through its nationally known Project Grace, has shown how we can provide the best care for the chronically ill at lower cost to all. Here in Chicago, our hosts, Cook County and Mount Sinai, are working with others to build a medical home network that will start by covering over 160,000 residents of the Southwest Side. Hospitals and doctors who used to compete have now embraced cooperation, building all of this on a platform of a shared electronic exchange of patient information. Out on the West Coast, Santa Clara Valley Medical Center in San Jose is also reaching out to its community. Its professionals are extending their care to people who are hard to reach in traditional settings through the Valley Homeless Healthcare Program. Over 1,000 miles away, the LSU Health System is achieving best-in-class results with its disease management program. With a comprehensive statewide registry and a focus on engaging patients, they're now providing exceptional care to over 23,000 diabetics, with outcomes exceeding national standards. In Columbus, Ohio State University Medical Center, the jobs engine for Central Ohio, is planning a health innovation zone that will lower healthcare costs while confronting the social factors that may lead to poorer health as well as genetics. OSU's regional impact already is nearing $2 billion per year, according to their Chamber of Commerce. And many of our members have extended their service beyond our borders. Just look at what one of our Florida members did. Many NAPH systems worked on earthquake relief in Haiti, but one, Halifax Health in Daytona Beach, actually worked, yes, with John Travolta, to collect supplies that he could fly in his Boeing 707 personally to the stricken island. You're also working within the four walls of our organizations to make sure we put our patients and their needs first. At Hurley Medical Center in Flint, Michigan, a patient and family-centered care steering committee is bringing together board members, nurses, doctors, managers, and most importantly, patients to redesign things like visitation and employee evaluations and start things like family rounding. For Hurley, four concepts are key: respect and dignity, sharing information, putting patients and families at the center of decision-making, and real collaboration. Orlando Health in Central Florida is making a huge investment in managing care transitions. They're leveraging telemedicine programs, care coordinators, and physician home visits in a campaign to cut readmissions. And one of the things they're doing is interviewing patients rehospitalized within 30 days so they can figure out how better to keep patients healthy and keep them home where they want to be. These are the sorts of real reforms that our people are delivering on every day in their towns and their health centers and their hospitals. And across our membership, many folks are taking these practices and using them to drive policy forward. Perhaps the most stunning example is in California. There, with our friends at the California Association of Public Hospitals in the vanguard, our hospitals have negotiated a groundbreaking Medicaid waiver that links payment to infrastructure for improvement, to reporting and moving many measures of quality and safety. Our California members have made their promise to their communities and patients and are willing to be held accountable for delivering results. Other states are studying the California situation closely, and I think it could be a model for the entire country. This is really the pathway to better health, and this is the road to serious long-term solutions for what ails American healthcare. So change is in the air. You can see that our members are changing, and that means that we at NAPH need to change as well. We are now starting to chart a course guided by just the sort of innovation I talked about. That's important, because to quote the great change agent, Yogi Berra, if you don't know where you're going, you might wind up someplace else. So to make sure we end up in the right place, we're strengthening our policy and advocacy efforts. We are engaging across the range of issues, a broad range of issues and audiences. Building on work that started under Chris Birch's tenure, we're making sure that NAPH is at every policy table, whether the issue is payment, disparities, workforce, financing, education of health professionals, or other things. NAPH members are responsible for over 1 million jobs and train 1/4 of our nation's physicians. They deserve no less than that sort of advocacy. That will require your help because we can't do it all. Increasingly, we'll be calling upon all of you and your expertise to help us out. To give one recent example, we asked renowned expert Dr. Solomon Liao from UC Irvine to bring his skills to bear in the National Quality Forum's palliative care work. Another example, Dr. Anne-Marie Sullivan from HHC in New York, who heads the Queen's Health Network, is now serving on a national body that advises the Health Secretary on performance measurement. Now, to keep this policy and advocacy work moving forward and to keep it energized, I'm also pleased to announce the hiring of Beth Feldpush as our new Vice President for Policy and Advocacy. Beth comes to us most recently from the American Hospital Association's DC office. There, she has worked and led on a variety of issues, including health reform implementation and value-based purchasing. We're delighted that Beth is coming on board, and please, Beth, give a wave. Change also means supporting our members as they work to innovate and provide seamless care. This is important for our patients, and it dovetails with all our efforts. The better we lead in this area, the better we will be at putting forth policies that strengthen healthcare in America rather than undermining it. The growth of NAPH in the innovation space was clearly foreseen in the 2010 strategic plan. And to fulfill that promise, we're doing several things. First, within weeks, with the support of our research affiliate, the National Public Health and Hospitals Institute, we will begin feeding benchmark comparative quality data to our CEOs. While some of the data is blinded, we'll also allow you to see where you place relative to others. We'll also ask high performers to allow themselves to be identified so we can begin to learn from them. This will then drive a series of educational activities for our membership. We want you to get fast, actionable information that reflects what is increasingly expected of us in the marketplace, but also make sure you have the tools to make change. Second, this work will be housed within our new Transformation Center, which is another product of the NAPH strategic plan. That center is now starting to go live and will serve as the hub of our efforts to support your work to provide better care for your patients. Here you can see our new website that will allow us to share this innovation among our members. But change is about more than reports and websites. It's also about leadership. So finally, to that end, I am also delighted to announce that Jill Steinbrugge will be coming on board as our Senior Vice President for Leadership and Innovation. Jill has had a distinguished career in the Kaiser Permanente system, where she led their successful and groundbreaking efforts to transform the patient experience of care. More recently, Jill has worked with safety net hospitals and clinics in California that has included identifying best practices at San Mateo Medical Center and UC Davis. Jill, hello, welcome. We're thrilled to have you. So change is happening here like everywhere else in America, but some things will not change. And one of those things is why we do this work. It is very easy when you're a CEO or head government relations or a chief nursing officer to forget to do what we do. I don't think any of us chose this path because we thought our highest calling was to balance a budget or advocate for a funding stream or to achieve nirvana in our skill mix. We did it because of a promise we made to ourselves, to our communities, and to our patients, that we would extend a healing hand, that we would, in the way and profession that we chose, try to make health and life maybe a little bit better for those around us. This is the same promise that was made by an NAPH system to Linda, an expectant mother in South Florida. 6 months into her pregnancy, Linda was told by doctors that her unborn baby, to be named Claire, had severe congenital heart defects. She was diagnosed with something called tetralogy of Fallot, a hole between the lower chambers of the heart and a blockage of the flow of fresh blood from the lungs. Without expensive and complicated surgery, children with this sad defect almost all die before they reach 20 years. But the great majority of cases can be fixed, with the children living active lives for many years to come into adulthood. Thanks to an NAPH member system, Claire got this surgery. This was the Joe DiMaggio Children's Hospital in Hollywood, Florida, at Memorial Health. The surgery was a success. As Claire's mother said, she was born with a broken heart, and we fixed that broken heart. This is Claire now. Today, she is a healthy and vibrant little girl because of that promise and the promise that member kept. It is what you do 24/7 every day, no ifs, ands, or buts. That is why I came to NAPH, because you have made a promise to children like Claire and millions of others. Because of the things that you do and the energy you bring, the future of healthcare and the safety net is very much a bright one. There may be a rocky road ahead, we'll be tested, but I know that your promise will hold. In turn, I promise to do my very best for you and your patients. Thank you for what you do for literally everyone in this nation, and thank you for asking me to join you in this journey. So I have the tools of the trade now, and thank you for joining us this morning. We're going to have about a minute transition as Sean Grebinger and our next distinguished panelists come up and get mic'd up. So just about be a minute. Thank you.